how are you doing? My name is Chris Matthews. I'm your relationship coach and licensed marriage and family therapist. In this video, I'm going to provide you guys with a brief 7-step assessment you can use to determine if couples counseling is going to be a good fit for you and your partner. So, first and foremost, counseling is amazing. I believe in therapy. I know it can work. However, therapy, like any tool, can only work when the job that it's used to work for is relevant. So if you need to hammer a nail, you don't go get a screwdriver. Therapy is the same way. So in this brief assessment of these 7 different areas I'm going to process with you guys, I want you to use this video as a checklist to determine if you and your partner will be a good fit for therapy. Therapy, as you may know, costs a lot of money and time, and I would hate to see you invest in something that just outright isn't a good fit. So first and foremost, mutual commitments. This is crucial. Do you and your partner both desire to make it work? If you don't have a commitment to the relationship or each other, then the goal of therapy may not be relative for you, because therapy is designed to produce some form of outcome. So if there's no commitment at the start, then therapy isn't going to be a good fit for you. Individual therapy may be a good fit for you because you can work with a clinician to determine what you want. But if you don't know out the gate that you desire to commit to that person or build a commitment or try to establish it, then therapy with a couples counselor isn't the first place to start. I would advise going to individual therapy first so you understand if the commitment is there. That's crucial. So number 2, shared investments. When couples have shared investments such as children, business, property, they have external factors that are going to keep them closer or connected together in some capacity. They tend to have a stronger commitment for the process. Couples that are experiencing any type of betrayal, and I talk about infidelity a lot because 3 out of every 5 couples I treat, there's some form of infidelity, and that's the reason why. So that is one of the most common reasons why couples seek counseling. So that's a lot of what I do in my work. And the couples that have children and they are good parents together, they usually have a higher satisfaction of making the relationship work after infidelity. And that's because of the investment that they have together. It's something to work toward or for. Couples that don't have any external attachments, it's easier to depart. There's nothing that's really keeping us together. There's no real incentive to want to make it work or to feel like it needs to work. Number 3, have the required resources. If you don't have the required resources, couples therapy is not right for you. So what are the required resources? One resource is going to be time. If you don't have the time to commit to the regimen of sessions that the therapist has presented, then it's not going to work. I'm going to tell you why that's so critical. I had to break this down for a client, and after I explained it, he and his wife were very adamant about not missing session. So as a couples therapist, usually we'll meet with clients 1 time a week. If it's a trauma or if it's something pressing, some therapists may meet with you and your partner twice a week. But for the most part, it's usually 1 time a week. Those sessions could range from an hour to an hour and a half. During that time, the therapist is presenting techniques, tools, strategies, implementing models and theories. They're also being an active listener. They're assessing. They're doing a lot of different things. From that hour and a half, the intent would be for you to go back home, apply the material, collect your own feedback, and then go back to the clinician again the next week, and we start the process over. If a week is missed or if the sessions aren't continuous, then the therapist has to start all over again, re-get to know you and your partner, understand what happened between the session, and we never really get traction. So within those first 4 to 6 sessions, I strongly recommend that if a couple do not have the time to commit weekly for those first 4 to 6 weeks, then they're not going to be a good fit at that time for couples counseling. So a couple might call and say, hey, Chris, I want to schedule, but we got a vacation in 2 weeks. Wait until after the vacation, because I've noticed that when there are gaps between treatment, the success rates are lower. Another resource, be willing to work on yourselves. I see a lot of success rates for couples that are also doing individual therapy or have a history of individual therapy before doing couples counseling. This is why. Couples therapists are treating the relationship as the client, not two individual people. So if I'm treating the relationship and one partner has a severe mental health issue or concern they haven't dealt with, or they have stressors or internal issues they haven't processed, that's going to be brought into the relationship. At that time, I don't want to be an individual therapist that has the partner present as a spectator. I want to make sure I'm involving both partners equally in the session because I'm treating the shared space they have together, which is the relationship. So if those partners aren't or haven't worked on themselves, then couples therapy at that time may not be a good fit. A prime example would be a couple I worked with, and the female partner endured some childhood trauma. And that childhood trauma was coming back up as she got older and she and her husband had children. She was abused by a caretaker while her mother was at work. That then came back up when she had a child because she didn't trust her child being in childcare or outside of her site to do any type of childcare or developmental center stays. That put a strain on the family system and the husband because she quit her job and he had to take on an additional job. From individual therapy, she was able to process her childhood trauma. So then when we came into couples counseling together, I was able to then introduce strategies and techniques that could allow for her to become more comfortable with her daughter being in childcare. And I talk about this more in my book, Finding Your Relationship Fix, The 4 Reasons Couples Seek Counseling. The next area that I like couples to assess before determining if couples counseling is going to be a good fit, their receptiveness to change. It's so important to understand that therapy is about the production of something, the production of insight, the production of knowledge needed to make a decision. It needs to produce something. Therapy should not just be a venting session. There needs to be something produced at the conclusion of the sessions and the treatment plan. That's why therapists establish with the client, working in a relationship with the client to develop therapeutic goals and objectives. We need to be hitting these metrics to make sure that change is on the other side of the process. So if your partner already has made their mind up that they won't be open to certain interventions or techniques, then couples therapy is not going to be a good fit. The one that comes to mind is usually around infidelity. If the person that cheated comes in the session and they're unwilling to relinquish privacy, if they're unwilling to be open, then at that time, couples counseling won't be a good fit. Because one of the first strategies or techniques that couples therapists use to help bridge the gap after infidelity is educating the cheating partner on the benefit and values of being open to help regain and establish trust. Another example that comes to mind when it comes to being receptive to change would be a partner that's unwilling to stop engaging in certain behaviors. So if a partner is uncomfortable because their mate is seeking relationships with an ex or maintaining relationships with an ex or seeking out cordial, casual friendships that make them uncomfortable, and that one partner has decided that they won't dissolve those relationships, then they're not going to be open to changing or developing a new process that can support the relationship. Next, I always make sure that the couples like each other, not just love each other. Why is that important? Most people that divorce still love each other. They just may not like each other. Liking your partner looks like wanting to be around them. If a couple come into counseling, mind you, talk therapy, that's what counseling is. If they're coming into talk therapy and they've chosen not to talk to each other for months, sometimes years, they don't like each other. They sleep in separate rooms. They have 2 separate lives together, and they come into couples counseling, then there's not really any type of relationship present to mend. They've already become disconnected. They've already have established 2 separate relationships. There's nothing to counsel at that point. So making sure that you like each other and you want to be around each other, not just love each other. Lastly, I make sure that I assess for safety and security. The American Association of Mental Health describes that there are no valid treatment methods for counseling couples that are physically violent. If you are physically violent with your partner, that is not going to be a good time to do couples counseling. First, the partners need to look at doing a batterer intervention program and individual therapy. This is why. If you can't sustain physically assaulting your partner, then couples counseling isn't going to be a good fit, because in couples counseling, emotions will rise. So if I can't trust you keeping yourself and your partner safe, then I'm not going to apply pressure through couples counseling, increase emotional arousal, and you both or one partner doesn't know how to manage those emotions without physically being violent or abusive. That also includes emotional and verbal abuse as well. I would hate to be an agent of disruption versus an agent of change. An agent of disruption looks like the therapist evoking more harm than good onto the couple or the client. That would happen in the event a partner is a gaslighter or they use therapy as a way to make the other partner feel bad or worse. I had a couple, and the male partner, he did that. He would attempt to try to use therapy as this notch on this checkbox, or this notch on his belt. Like, hey, I did what the therapist said this week and you didn't. I'm good, you're bad. That's not what therapy is about. It's not about trying to prove something to your partner. It's about making sure that you're applying the skills and techniques so the relationship as a whole can grow and get better. And that's both partners having mutual satisfaction and enjoyment in a relationship, not just one partner trying to use therapy to say, I told you so, or to make a partner do what they want them to do. That's not the goal of couples counseling either. So just to recap, mutual commitment, making sure you have shared investments, have the resources, the time to do therapy and to attend therapy, have the willingness to work on yourself. Make sure you like each other, not just love each other. Also be receptive to change. And then last but not least, make sure you both feel safe and secure physically, mentally, and emotionally prior to going into therapy. My name is Chris Matthews. I hope this video helped you and your partner determine areas you need to assess before hiring or seeking out couples counseling. Once again, I'll continue to do videos on this topic in addition to making sure I provide quality content to help you and your partner have a healthy, happy, and sustainable relationship. Please subscribe to the channel, and I look forward to seeing you on the other side.
You can never go back, I gotta take it all.